Hello everyone, welcome to the University Technology Mara Medical Department. Here we have compiled videos of core physical examinations. Those examinations include cardiovascular examination, respiratory examination, abdominal examination, upper limb examination, and lower limb examination.
Cardiovascular examination. Introduce yourself to the patient and remember to explain briefly your intentions to examine. Explain to them. Ideally, all patients should be offered a chaperone before any examination. The patient should also be adequately exposed. Remember to apply alcohol gel on both your hands before examining the patient. Remember to take a step back and perform a general inspection before looking at the patient's hands. Looking at the hands, you should appreciate for signs such as clubbing, any stigmata of infective endocarditis such as Janeway lesions, Osler nodes, and splinter hemorrhages, any evidence of tobacco use, peripheral cyanosis and dyslipidemia, as well as anemia. Then, calculate the patient's pulse rate. Appreciate the patient's rhythm, volume, and also character as well. Check for radial delay. Ask the patient if there's any pain in the shoulders or the right side before checking for collapsing pulse. Now look at the patient's face. Look for any evidence of conjunctival pallor. Look at the mouth for evidence of central cyanosis. Now, assess for JVP or jugular venous pressure. Inspect for jugular venous pressure while the patient is lying at 45 degrees. Hepatojugular reflux can be applied to elicit a rise in jugular venous pressure. Feel the carotid pulse to appreciate for pulse volume and pulse character. Now, have a closer look at the chest. Remember to adequately expose the patient, take a step back, and do a general examination or inspection. Look for any evidence of scars before examining for the apex beat. On the lateral wall of the left chest. Once felt, identify the exact location by counting down the number of rib spaces. Also appreciate the character of the apex beat. Next, examine for heaves and thrills. Now, auscultate the heart. Begin by listening at the apex, located in the fifth intercostal space, mid-clavicular line, using the diaphragm of your stethoscope. Then, use the bell. Next, lie the patient on his left and listen again to the apex. Next, listen to the other areas of the heart, including the left lower sternal edge, fifth intercostal space, second left intercostal space, and second right intercostal space. Then listen to the carotids. Also listen to the axilla, looking for any radiation or murmurs. Now, encourage the patient to sit forward and listen to the left lower sternal edge in the fifth intercostal space. This is to appreciate the murmur of an aortic regurgitation better. Now listen to both bases of the lung. Appreciate any crepitations or crackles heard. Also test for sacral edema. Now, have a look at the legs. Appreciate for any pedal edema. You should then thank the patient and ensure that the patient is covered up and comfortable. The examination should be completed by checking the patient's vital signs for blood pressure, and if considering infective endocarditis, to check the patient's temperature, perform a urine dipstick test, and also fundoscopy.